All right. Hi, everyone. My name is Pang. I'm the program manager for Innovation for Change East Asia. Welcome to COVID Conversation 2. I'd like to introduce our director, Corina. She will introduce I4C and also the series.
Okay, thank you, Pang. Hello, I'm Corina. I'm from the Philippines. I live in Manila. Um, Innovation for Change, briefly, is a is part of a global initiative which is present in 7 regions of the world. We cover the East Asia region, and the main work that we do is to defend, expand, and create civic space for rights defenders and those who are helping people around the world. So we work through online spaces as well as in-person activities in the region. And with the onset of this pandemic, we thought that perhaps there had to be um, initiatives from our part to reach out to human rights defenders on how to um, cope with the pandemic as it impacts on their personal lives as well as their work. So we started this series of COVID conversations, and the first that we had was to focus on how it impacts marginalized communities. The call for the lockdowns and the call for social distancing had a very different impact to the communities that are marginalized. And so we thought that perhaps that had to be brought to the attention of the public, that it's not very easy to just say practice social distancing because it's not possible in amongst marginalized communities and sectors. And so the second one, which is today, I will ask Pang to elaborate more on this topic.
Thank you, Corina. I think over the last few years, since the start of Innovation for Change East Asia, every time we have our meeting or conferences or activities, we've been hearing increasingly more and more people raise the issue of mental health, and we notice that there has been an urgent need to also look after the mental health of people who defend human rights, because I think uh, we need to acknowledge that for those who are part of for leaders within vulnerable communities, they are dealing not only with the mental health issues of inequality, but also dealing with the mental health issues of their community. So there are multiple burdens that are being lifted, and it can be very exhausting. And on top of that, I think we are also aware of the economic impact of mental health on mental health, especially with the fact that a lot of people in civil service are paid quite low, and there is definitely a mental health cost to that. So I think on overall, we're becoming more and more aware, and I think this conversation is just one part of us trying to pay attention and giving us space to talk about it among ourselves and learn from each other across the region. And I think there's a lot of wisdom and a lot of knowledge that we have within our communities, and there's a lot of space to share. So that's why we're here today. I would like to also introduce our media person, uh, Marissa, and I don't think she knew that we're doing this, but Marissa, maybe you can help us uh, just say a bit about the participants who have signed up for this session, and also introduce what you'll be doing for this session.
Good afternoon, everyone. I'm Marissa. I'm based in Manila, the Philippines. I help out with the I4C East Asia as their Research, Info, and Communications Officer. This afternoon's conversation will be very intimate. We are now at about 20 participants, which is just a good size for this conversation. We got registrants from about 11 countries, mostly in Asia. And because our speakers are obviously from Malaysia, Singapore, and the Philippines, we have the most coming from those countries. But also as far as South Africa and even North America. Most of them, of course, are human rights defenders themselves or working with communities, human rights. Others are educators and also still in school. So some are interested to be part of this conversation, not just to learn, but also, and not just for their personal needs, but also how to impart that to either students or colleagues or to their communities of work. So those could be women and girls in development work, migrant communities, LGBT. We also have people working on family health, the youth, capacity building, and someone was very interested in how mental health and the arts should work hand in hand, as a coping mechanism. Others are looking for basics like psychosocial support, learning new mechanisms, managing mental health, etc. The rest, I guess, you will get to discover as we go through the conversations, the question and answer. And by the way, I will be monitoring the chat section. For those of you who have burning questions, you could either type them, so we will notice them, and Pang, of course, will try to call on you later. But if it's really, really urgent, you could also use the raise hand button, and Pang will, of course, see if it's appropriate for you to talk at that certain time. So I hope we have a very good and productive conversation this afternoon. See you later.
Thank you, Marisa. So quickly also to acknowledge, we have Philip, who is handling the Zoom backend meeting, and also Isari, who is our finance manager. Yeah, hi Isari. Okay, I think we can start. I want to say that maybe what I would like to start off with is to ask everyone to write in the chat here one or two words to describe how you're feeling right now. So this is just a quick check-in. If you can just write one or two words of how you feel or a thought about your state of mind, state of your emotions, state of spirituality in the chat. Do you see the chat on the right? Yeah. Including the I4C team as well as our speakers. Katrina feels drained from numerous conference calls. Numb and hungry by Gavin, who's in the next room. Karina's calm and but excited. Willing to share personal experiences from June. Feeling calm. Feeling good. So you've been practicing working from home, yeah, Andrew?
Yes.
Excited, feeling good and excited. Wow, it's all been very positive. Okay, so I don't think we have a problem here. I think that's the end of the conversation. Bye. All right. I guess there is a range of feelings. Okay. Someone's feeling worried as well and tense. All right. So now, before we start, I'd like to ask everyone if you can just mute your mic and also consider turning off your video so that when the speakers speak, we will see the speakers first. I'd like to jump straight into our first question now for our speaker. So, to our guest speaker, oh wait, I should introduce them. Oh my God, I'm terrible. Okay, we have Yang Fa, who is from the organization Uga Chaga. He's a registered social worker in Singapore supporting LGBTQ communities on issues including mental and sexual health, relationships, sexuality, and identity. We also have Bisla Kumarasan, who's a clinical psychologist active in LGBT communities and women's groups in Malaysia. And we have Dr. June Pagaduan Lopez, who's professor of psychiatry at the University of Philippines, Manila, and currently an expert member of the UN Treaty Body Subcommittee on the Prevention of Torture. I'll let them also tell us a little bit more about what they do by the way of the first question, which is Yang Fa, Bisla, June. Tell us a little bit about the mental health impact of the pandemic, the lockdown, the isolation on yourself. Yang Fa.
Okay, we're going. Hi, everyone. Very good to be here on a Monday afternoon, and it's a nice, intimate kind of a sharing. So personally, well, professionally, as Pang has introduced, a big part of my work is supporting the mental health of LGBTQ communities here in Singapore. That's, as you can imagine, a pretty important part of our work in Uga Chaga. So the team that we have of staff and also very dedicated volunteers, we run a range of counseling services. Coming back to that very personal question, you know, impact on me, myself, well, of course, I like to think that I am, in some ways, over time in my professional career and also my personal life as well, I have very fortunately built up very thick reserves in terms of mental wellness, and I would describe that as resilience. In my current job and also my previous job, I've worked in situations where there's been crisis, working with clients. In the previous job, I was working with suicidal clients. So I've learned a lot professionally and personally on how to deal with crisis, with mental health crisis and with suicide crisis. And of course, even though it's a professional role, I learned I tried to build a lot of that into my personal life as well. So now, if anything, you know, it's really the time, better now than ever, to tap on those reserves and resources that I've stored and kept and built over the years. So what I mean by some of these resources and reserves, which I will share more along the way later, you know, awareness of myself, my body, awareness of my thoughts and feelings, where I am, where I'm going, what's happening. Just a very quick example, not this morning, actually for the past week or so, I have to deal with some, without going into too much detail, some unfortunate situations that are client related. I was noticing some of my own emotional reactions as well, because it is a crisis. It's a crisis related to an individual amidst a crisis that's national and global in scale. I had to really remind myself that I am doing this not for myself. I'm doing this to support somebody else, and I'm not doing this alone. I've got the help and support of my team in the office, and working from home, of our volunteers who run our counseling services, and also we also work in tandem with the other agencies as well. So it's a multi-layer process. Of course, it's absolutely tiring, it's exhausting. I believe I'm not the only one in this room right now who can relate to feeling exhausted and tired sometimes. So it's that reminder that we do what we do, we all have reasons, and later maybe we can also have a bit of time to share a bit about what keeps us going as well. For me, I can say a lot of what I do comes from personal experience as well as my professional training. So sometimes even going back to basics, why we do what we're doing. So long story short, my mental health has been impacted, and yet I'm aware of it and I'm doing things to balance that as well.
Thanks, Yang Fa. Bisla, you want to go next?
Right. Hi, everyone. So how has this impacted me? I live alone, and I think the most immediate impact is not having human contact, like real human contact. I'm a person who loves hugs. I enjoy hugs, receiving hugs, giving hugs. I desperately miss hugs and just plain human touch. I've been very fortunate in that I still go to work. I practice in a hospital. So I, and my clinics are twice a week. And I look forward to these just so I can talk to a real human being, even if it's just even if it's just the hospital team, my team who's at the front desk. I really look forward to seeing them. On a more personal level, the MCO, in Malaysia we're calling it the MCO, the Movement Control Order. The isolation, the uncertainty of this whole thing has actually brought to the forefront a lot of my own personal trauma from my past. I don't deal well with uncertainty. Nobody does. I think very few of us have the ability to deal with that kind of uncertainty. But this has brought up a lot of my old issues. I am in therapy, and I'm very fortunate to be able to continue therapy throughout this time. But it has been quite a challenge to have to deal with my own issues, and also then to be available to other people to help them process theirs. So I've had to be very clear about my own boundaries. I've gotten a lot of requests to help with, for example, things like volunteer helplines and stuff like that. These are essential services, I know, but I've had to say no to quite a bit of them because I recognize that if I don't prioritize my own mental health, I am not going to be as available to other people. And I also firmly believe, you have to mean what you say. If you don't, your clients will know, the people you're working with are going to know it. They are going to pick up on that dissonance, and that's actually going to cause more harm. So I'm very, very mindful of that. And I do what I can. I recognize my limitations, and I have to trust that the other services that are available are doing a good job.
Thanks, Isla. June? June, your mic is off.
Okay, thank you. Well, I really took a long time thinking about this question, because as a mental health professional, I normally don't talk about myself. But I said I was so looking forward to sharing more of my personal experiences in this forum. I think I'm answering it in two ways. One is what I learned from my patients and from the different webinars we've been conducting on mental health and COVID. And essentially, I have heard the elements that help people cope, and also the things that make coping very difficult. But first of all, I would like to agree with Visla that COVID experience, the pandemic, is no less than a traumatic experience for us all. And I think human rights defenders are not superhuman beings, not to be affected, right? And that is colored by the nature of our political situations. How helpful, how supportive it is to our work, or how threatening it is to our work. Unfortunately, you may know that it's not easy times in this country, in the Philippines, politically at the moment. So personally, I've had to ask myself, how do I survive this? What do I need to survive? I think like everybody else, it's the uncertainty of things. It's the suddenness of the pandemic. Even if we were being warned, even as doctors, it didn't sink into me until middle of March when we got locked down. And I have friends medical people who were already affected and actually did not survive COVID. So the threat to life is very, very much looming in everyone's head, and including my head, because the deaths have come very close to home. They are my doctor friends dying, and because they don't have the proper protection to help other people. It is also coming very close to home because this kind of traumatic experience is not only threatening our lives, but our livelihoods. All of us may be lucky in a sense if we are salaried, but for doctors, we are not seeing our patients. We are not having any income, much like everybody else who are in the marketing business maybe. So the uncertainty is definitely more than life-threatening. It is also threatening our very lifestyles. So I am subjected to all that, but what have I learned from my patients and my colleagues? First, I needed to be mindful of what this thing is doing to me. In the beginning, I was in denial and I was putting myself in very high risks of contamination. I was meeting groups without even wearing a mask. And now I see that some doctors who have succumbed and died were kind of that complacent. Secondly, so I learned to check myself. What am I going through? Am I in denial? Am I behaving like everybody else, minimizing the threat? But then I also decided to be kind to myself, compassionate to myself, and say, I'm not alone in this feeling. I should not be angry with myself. I decided to be task-oriented. I say this, I started personal protection equipment campaign after I saw half of those doctors who have died were friends of mine. So I saw that immediate, most urgent need is to supply personnel protective equipment if we are to save our frontliners. And to me, this was the best move that I've ever made. It is not part of my work as a human rights defender, but it's part of my work as a healthcare provider, also to protect my colleagues. So I'm very much in the middle of a huge, huge campaign for funds, donations in kind to provide. We have so far provided 300 hospitals, all from the private sector. And the private sector was just waiting for a credible, trustworthy organization to give their money, their contributions to, and we provided that. And for that, I have found a task. I have become task-oriented through all. And I think that's the most important thing to keep yourself sane, is to have a project and something to wake up for every morning, and not to count the days when the lockdown will be lifted, right? And compassion, I think it's very important that one COVID patient we interviewed, a broadcaster in the documentaries, a TV journalist, said he decided to make a documentary about himself. He was a patient and he taught his nurse to use his camera, and also talked about the difficulties of his nurse as a caregiver, being a frontliner, being quarantined himself, not seeing his family for the last number of weeks. And then, of course, the support of his family, especially his wife. And my support is, well, I am single, I am alone with 3 cats and a dog, rather 4 cats. I'm lucky to have help with me, but essentially I live alone. But I think more than social distancing, COVID has brought us social cohesion to digital technology. We are talking to each other more. We are being more present to each other. Whereas before, we might be together physically, but we are not really talking to each other, especially families. And finally, to me, what has helped very much to this very traumatic experience is to find meaning. What is this all about? And all of us are asking, if we are a bit of a religious person, why did God allow this to happen? What is God's message? I'm more spiritual than religious, and I believe that the universe has also sent us this for a reason. So to me, meaning making is the final step, to find something that tells us, gives us a message, and for us to listen to that message. Thank you very much.
Thanks, June. Very thorough reflection, and I hear from different ones of you. There are different aspects that actually help, and I think we kind of since we already started going to reflections on what are things that help. Maybe we can just keep moving on that line as well. But as we approach that question of what are things that we are doing that can help, I'm hearing different strategies. From Yangfa, it's about the idea of knowing you're not alone and being part of a larger community of people doing this together with you. From Bisla, the drawing boundaries, telling yourself it's okay not to do too much as well. Whereas for June, it's knowing that there's something to do, and also not being complacent, finding meaning. I myself noticed that, for me, it has taken more energy to start the day or to do something, which I understand is one of the signs of depression, when you actually require more motivation and energy to push yourself to do something. But once I start doing, I can't seem to stop, and I recognize, because I started therapy also about 3 months ago, I also recognize from what my therapist said that I have an over-functioning personality, which means that under anxiety, I do more, I over-function. And so this is very interesting for me because we usually, I think as we live in this scheme of the world, right, with the capitalist model and also the way we are told to work, being more productive is always seen as a good thing. So we never question that. We only question the people who shut down, right, who don't function. And so we see over-functioning sometimes as a good thing, but a lot of us don't realize that it's also a symptom of a problem. It's also a symptom of anxiety. And actually watching yourself and not burning out is very much part of it. And I think a lot of activists may also not be aware. So I'd like to use that actually just as a way of us jumping into also thinking about how activists function, what are some of the mental health burdens and impact that human rights defenders, social workers, people who work with communities, people who are on the front line now, what are they dealing with? How can they be more aware of what they're dealing with? Yeah. Okay, Rizla.
I just want to respond to something that you said, Pang. You said that you notice these days that it takes you longer in the morning before you start functioning. And you said that that's a sign of depression. I want to caution against calling it or calling these things depression or anything like that during this time. Because like what June said, this is a traumatic experience. And we are all responding in the ways that we know how to a traumatic incident, right? So it's okay if you need a longer time in the morning before you get started. It's okay if you need more time in the evening to wind down. It's okay if you need more to sleep in a little bit more. It's okay if you need more breaks between your work. It's okay if you need to stop work early. all these things are okay because the situation that we are in is not okay, right? And you also said burnout, and this is something I'm very concerned about. I'm getting a lot of questions from people as to how to be productive at this time, and I'm telling them, you're asking the wrong question, because the situation that we are in now is not just until when the lockdown is lifted, right? This is the long haul. We are looking at least 2 years, right? Because we're waiting now for a vaccine, and then the vaccine has to roll out, and then all those time, at least 2 years we're looking at of living like this.
Come at all, right?
Sorry?
If the vaccine come at all.
Exactly, right? Of living like this, of living from home, of being socially isolated, of being things cut off, of having things cut off, of having our livelihoods affected, all these things. We're looking at least 2 years. And this, people focused on the short term, how to be productive now. You are risking burnout because you're not preparing yourself for the long haul. We're thinking of short-term solutions rather than preparing for how to wear this out for the, I don't know how long. It could be a matter of months. It could be a couple of years. We don't know yet. And we are being given information in very piecemeal formats. And so we have very little to go on to plan. We have very little to go on in terms of anticipating, or even I'm a big believer in building hope through imagining, right? And even when I want to imagine something, I have very little information to build that imagination on, So this is something that I recognize in myself, and I have to keep doing over and over again. I have to build, deconstruct, rebuild, repeat multiple times, right? And that requires energy, and that requires sustained conversation with people, of constantly asking myself questions, of being in periods where I just don't know, and being okay with not knowing, and recognizing that from not knowing also new things can sprout. And this is something that's very new to me personally, for example. So it's dealing with multiple things at the same time. And these things draw a lot of emotional energy. These things draw a lot of physical energy. For the first half of the lockdown, I found myself just sleeping and sleeping and sleeping. And now I can't sleep, And I'm sitting there, I have to catch myself wondering what's wrong with me. And then I realize I'm asking the wrong question. And I just have to do what my body needs to be done, because it's trying the best way it can to deal with the situation that it is completely unprepared for.
I want to jump in and absolutely echo what both Vizla and June have been saying. Something both of you have kind of touched on, the idea of trauma and the emotional reactions, and how it's really so abnormal. It is not normal what's happening right now. And when things like that happen, I just add on an additional emotional reaction that perhaps many of us are going through, the idea of loss and grief. So trauma, loss, and grief often go hand in hand together. And when we think about it, we are experiencing, many of us are experiencing multiple losses: loss of freedom, loss of certainty, for some, loss of practical things like jobs and homes and livelihoods. So that sense of loss, some of it is describable in words, like what we're doing now. Some of it is just felt, the sense of loss. So there's the individual losses that we are experiencing, trying to figure out, and it's a very human instinct or reflex. We try to deal with loss cognitively, and yet we know loss is an emotional experience. So a lot of it is what we are trying to grapple with, loss and grief. As we all know, for those of us who have experienced grief and loss, we all deal with loss and grief differently, some in similar ways, some in different ways, some maybe perhaps more productive, and I use that very carefully as well, some more productive than others. And the point June makes about that meaning as well, perhaps it will also take time for us to make meaning of the losses and grief that we're experiencing. And we all know loss and grief is difficult.
May I jump in? Yeah. I'm glad you mentioned that. It is a very important component of trauma and loss, but even just threat of loss. We have not lost our lives. We know some people have lost their lives. We are very certainly afraid of losing our livelihood, our lifestyle, our world even. And of course, our rights and our liberties are certainly the most vulnerable because COVID can be used to curtail everything that we are enjoying in terms of freedom. To me, this is really very scary. But I'm also glad Wisla mentioned that we need to also be non-judgmental about ourselves. And this I call self-compassion. And also someone was mentioning correctly in the chat that we also have to guard against being project-oriented or being hard on ourselves so that if we don't have a project, then we are failing in terms of coping. Let me elaborate what I mean by this. A project is not a real project in that sense, of a big deal mission that you might want to put on yourself during these times. It could be going back to baking, which I did. I never baked since my high school days. And I successfully baked on the second time a banana bread. It is feeling productive and making yourself feel creative. And people, if it is time for them to finally clean up their house, their things, do some gardening, this is what I call projects. Because we need to be task-oriented. It's more the task orientation and how that task could be very small for some people, but can be quite big for you. Even just being 24 hours with somebody can be a project, could be a challenge. If you don't have a good relationship with someone now you're forced to stay with, you have issues with your partner or something, it becomes a task, a project. And I like to mention that typical of human rights defenders or perhaps caregivers in general is this feeling of guilt, survivor guilt. If you're not doing something, then you're not being what you are, right? How many of us hate to stop? And when we stop, we're wondering if we're missing out or somebody is missing us and not being available. So sometimes when I wake up in the middle of the night, 3 o'clock, 4 o'clock, I will confess, I grab my tablet, my phone, and check if there are any urgent messages for me. This I need to do, and I've not been able to do, honestly, keep away my gadgets at least 2 meters away from my bed. And that is because, well, my daughter said, Mom, you are suffering from FOMO. And for the millennials, there is fear of missing out, right? But to me, as a caregiver, as a health professional, mental health professional, it is really survivor guilt. Because so many other people are in worse situations than we are. And we think it is our job to continue fighting for them, doing things for them. And there is also vicarious traumatization, because we are not immune to what we hear and see. Recently, I received a message that one of our overseas workers who arrived from the Middle East, sexually abused, committed suicide in one of our host hotels just several days ago. It is shocking. And I've asked my colleagues, my fellow psychiatrists, what can we do about it? And then there's another news that a psychiatric patient was shot by a police, supposedly, reportedly, for breaking curfew. And we're all stuck. My colleagues are all stumped because they are afraid for themselves. They are afraid to go out on top of being targets. And that's what we're facing, I think, additionally. Apart from this invisible virus, we are all threatened by the huge scenario of no less than martial law or martial law-like situation being imposed on us. And how does that affect our lives as human rights defenders? I think that's the big question.
Go ahead.
Yeah, I echo everything that June said. And I also want to add, like, you know, even when, for example, I create these pockets of activities or projects that I recognize is good for me. For example, one of the things I really enjoy doing every day that really helps me is cooking my meals. And my evening meal especially, I'll cook it and I really enjoy it. For 20 minutes, I'm completely lost in what I'm doing. You know, I'm experiencing joy, and then I set my plate, and then I'm sitting down to eat, to enjoy my meal. And then I hear the sound of the drones outside outside where I live. You know, and then I hear the sound of the blaring of the police siren because somebody has broken the curfew and is outside. And automatically, everything that happened in the 20 to 30 minutes I took to cook my meal, to sit down and preparing myself to enjoy my meal and feel like I'm okay for a little while, and that is just broken like that because there's a reminder that things are not okay. You know, I live in a high-rise building or in a condominium apartment building, and sometimes, yes, there's the sound of families fighting, and that's also, you know, what I'm doing at that point, which is very normal, is broken by the fact that a reminder that it's not normal and it's not okay. So this is it's an ongoing process which I am struggling to navigate myself, you know, and the only thing I can do is take a few minutes out of whatever I'm doing to refocus myself, to bring myself back to the present. You know, the little coping mechanisms that I have developed, you know, recognizing that it'll pass, alert other neighbors that this is going on, please check on your neighbor, you know, to do that, and then start again, right? And it has been quite exhausting.
And actually, I just like to jump in there and say, I really appreciate Wisla when you mentioned how, you know, this the need for more energy now to do things, and all this is okay, right? And also how Yang Fa brings up the idea that, you know, the trauma, the loss, the grief that we are experiencing now is really quite extraordinary. But this reminds me of something as well. So one of the things that I've learned in my own therapy was to also locate some of the experiences in my earlier youth as actually traumatic events. I actually brush them off and tell myself they were not trauma. And I think one of the issue is we actually have been taught to normalize a lot of things in our life, right? That we are blind to traumas. We're not attentive to this loss and this grief that is actually happening. We also don't have the vocabulary for it, right? And this brings me to also one of the things that we've been highlighting throughout the conversation for the last half an hour. So before we go into the part where we actually talk about how we overcome it, one of the things that I'm becoming more and more aware of as I'm listening to y'all is that we still stuck with certain ideas that we have normalized and built in about productivity, about competitiveness, about usefulness, about survival, about our guilt, about our use, right? And I think Katrina pointed that out very interestingly in the chat as well, that even within the civil society, even in NGOs, there's an expectation to be productive or to work. So I like to ask if you all have some reflection about the kind of the kind of things that we have normalized that have been very unhelpful, that during this moment we now have an opportunity to rethink them. Because one of the things that really struck me about what Wisla said is that in not knowing, new things can sprout. And I also read an article recently that says that, a lot of us are working in a way as to try to hold on to normality, but normality did not work, right, before this. And so maybe this is an opportunity for us, right? So, but what are the things that we have normalized actually that have brought us here? What are some of the unhealthy ways that we have dealing with things?
I just have a thought. Don't know whether now is a good time to bring up. Well, I'm from Singapore, and now we hold the distinction of having the most number of COVID cases in Southeast Asia, 13,000 and counting. And just over the weekend, I was talking to a friend who's very familiar in working with the NGOs who work with the migrant worker communities here in Singapore. And I was just expressing my concern on how the volunteers, how the staff, and migrant worker NGOs are coping, because they're really out there. They are the frontliners right now, working with certain other agencies to basically support the migrant workers in the dormitories. And it was just a comment that my friend made about how they're all okay, they're all being stoic. And that was the word that kind of jumped out at me. There's almost like a certain expectation to respond to the question about how activists, human rights defenders, we are supposed to be stoic, that we have to act and do, and we have to be okay. I wonder if that's something that we have all learned and internalized, and for now, absolutely, the volunteers and staff of migrant worker NGOs, absolutely, they need to be out there doing the work that they need to do. And then back to another worry, I'm a worrier, another worry that I have is, how long can this go on for? It might be weeks, might be months, as we just commented on. This could go on for years. How long can we go on for? And the reality of burnout, compassion fatigue, vicarious trauma, secondary trauma, that, well, I won't say will set in. It's just a matter of when. So that's kind of my thought about challenging some of these ideas of stoicism, if you will.
I'll jump in. Yeah. When people ask me how we are coping and how we should cope, I generally talk about 4 F's. And it's a classic trauma psychology concept. The fight-flight response, right? When we are faced with something too overwhelming, terrifying, then most of the time we have 3 F's. And that is either to fight it, flee from it, or we freeze. And I try to explain the behavior of my fellow Filipinos, the street behavior, where it's so easy to criticize the poor for not obeying what is being said by the police, by the government, and so forth. And why, in the first place, even educated people like doctors did not heed the early warnings. And I think that is partly our flight response, escape from reality of COVID. And this is a very common thing when something is too overwhelming for you to fight, when you feel powerless. But the fight response is also not so much active fighting, a situation, but being angry and lashing out. And we've seen this, well, in the US, it's obvious that protests and demonstrations are directed against local governments who refuse to lift the lockdowns. And so that angry reaction to me is a fight reaction. Now, what is a useful fight and flight reaction in this situation? Fight is maybe we hope that eventually our bodies will find the means to fight this COVID, and the discovery or invention of a vaccine is the only way to fight it. For now, the way we fight it is to stay healthy and make sure our immune system handles the threat. The flight is our social distancing or physical distancing, our precautions. But there is the third F, which is to me the most ineffective, useless way, and that is to freeze. People who stay home, I have had to make a call to someone whose parents messaged me that the son was so afraid of having COVID because he was developing a sore throat, that he will not leave his room for fear of contaminating his children. And I had to talk to him that his symptoms were not COVID. There are these very severe, frozen, paralyzed reactions to trauma. And we're seeing this, of people who are staring at the wall, staring at the ceiling, simply not able to do anything, even the simplest chores at home. And then for me, there's the fourth F, and that is the face. We face reality. How is this affecting me? And the first thing is, we're all correct in this, I think, that we should not judge how we are feeling. It's even, I think we are more correct than not to say we are not alone. What we're feeling is shared by many who are undergoing this traumatic experience. And I think in the Filipino way, maybe more than a lot of other cultures, we use so much humor. My gosh, COVID jokes abound, relevant, irrelevant, irreverent jokes. And these are passed on. And in the beginning, I said, oh my God, we're so seriously in trouble and people are passing these kind of jokes. But short of accepting jokes that are truly, below the belt, I think this is helping people deal with this kind of a situation. So, how to cope? I think we need to be in the here and now as well. Mindfulness, being able to use practices like meditation to just be connected to ourselves, to know, to realize what this is doing to us. A lot of us are emotionally, intelligently challenged. What is this? EQ challenge. We are angry, we are scared, we are terrified, and we don't know it yet. We don't even know it. And people are just saying, why are you so grumpy? Why are you taking it on me? I have calls from my patients who are having fights with their husbands because the husbands are very grumpy or impatient, intolerant, and wives are simply also behaving the same way. So I think first of all is awareness. We have to be aware of ourselves, what it's doing to us, and then compassion, self-compassion, that as Vista said, this is something that is not unique to any one person, and we are not sick. This is not a psychiatric disorder. And the reason we phrase it as trauma is because the most psychologically normal people will react in this way. You are not normal if you are not affected by this COVID situation.
I just want to respond to some of Katrina's questions. she's asked a few things. She said, how do you pay attention to what's happening to your body, and what was the question? You don't know if you can trust that it will be picked up by others. The circle of activists we're in who could pick it up are also really struggling. And then another question about, how doing what we do is not just a job, it's also a core of our identities, of who we are. And then how do you not do it, right? How can you, what is the object, we have a moral obligation to do something. I don't have a direct answer to all of these questions, but I have been thinking about them. And I think something that Bell Hooks said, I watched a video, I've been watching a lot of Bell Hooks videos on YouTube to help me cope with what's been going on. And there was something she said about decolonizing our imaginations, about not getting stuck, about being able to see things differently, imagine a different future, imagine doing things differently, imagine living differently, imagine being differently. And I'm bringing that up because I think it's also, as activists or human rights defenders, it's also important to recognize that where we are reacting from a knee-jerk response versus taking some time to sit back and imagining different ways of responding to a situation, right? Yes, the fear of livelihood loss is real. How can organizations, funders manage this? I was thinking, funders, they're also working in very capitalistic ways. We all have to compete for funding, right? Is there a way that all our work can be covered? How do you decide which work is different, more important, especially in a time like this when there's just so much need? And also remembering that our jobs isn't just to respond to the communities that we're working with. Our jobs also is to highlight to the government how they have failed. It's not our responsibility to go out there and make sure people have food. It's the government's responsibility, right? So diversifying our ways of working. Maybe it's necessary to build new alliances. Maybe it's necessary to recognize what didn't work before, to break those down and create new things now. This is going to work. This is a completely different situation. It's a completely different and unimagined situation that we are in. The ways that we have worked before, are they continuing to work now? Will they continue to work once the lockdown is lifted? Will they continue to work in 2 years' time? Or do we need to imagine a different way of working? Do we need to build new alliances? Do we need to build a new movement? Right? Apart from these questions, I don't know how else to answer. And when Katrina talks about how it's also part of it's not just a career, it's part of who we are. Yes, I definitely empathize with that. And every time I say no to something, I'm guilty. I feel guilty, but I have to recognize that I have to work through my guilt because my boundaries are just there, and that's important for me as well. I'm not. It's not just about me putting myself at risk of being infected and possibility of infecting other people, but also me running myself to the ground and making myself completely useless. And then what's the point of all of that anyway? So it is also about having these conversations with ourselves, how we see ourselves, how we see our value, how we see our worth as well. And as what June said, to just really exercise compassion. Now, June also talked about being mindful. And like when I say this when I say this in the past, people always ask me, what does that mean? I'm going to tell a story about what happened to me at the grocery store the other day, and this is going to exemplify what mindfulness means in the time of COVID. Okay, so I needed to get contact lens solution, so I went to the pharmacy. I got my contact lens solution. I paid for my solution, and I didn't take a plastic bag. And then after I paid, I remembered that I needed to get disinfectant wipes. So I left my contact lens solution at the counter, and I went back into the store to look for disinfectant wipes. And of course, they had run out of run out of stock. So I thought, well, I'll come back another day. I went back to the counter to get my item, but there was somebody else at the counter, and they were paying for their item. My instinct was to just go to the counter and pick up the thing that I already paid for and to leave. And I had to remind myself that I couldn't do that because that was going to violate the social distancing, the physical distancing, the 1 meter rule. So there I was back in line, right? Because I had to wait for this person to be done with their transaction, leave, and then walk to the counter and pick up what I went there for. That entire thing required a mindfulness that I never had to practice until that point. You know, and that also, of course, in my head, I was like, I want to go home. I've got stuff to do, right? And that required me to completely slow down because I was waiting in line again. You know, when I go to my grocery shopping, I'm waiting in line. You know, what would usually take me 20 minutes to do grocery shopping now takes me 2 hours, right? So, you know, these are the kinds of different ways of thinking and being that we have to start focusing on, of inculcating these new habits, this new awareness. And all this takes energy, and it requires a lot more compassion from ourselves, for ourselves, and the people that we live with.
Thanks for that, Rizla. I see, June, you raised your hand.
Yes, I'd like to segue from Rizla's sharing of the need to.
Sorry. Are you making a different point? Or
No, I'm reacting to Risha.
Okay.
Same question, yes.
Okay.
Of in the chat. I think that is really a correct way to go forward. That we need to review our former ways, what needs to be changed, and what doesn't work anymore, and what might still be working, and new alliances that have to be somehow adjusted. But before we can do that, I think we need to ask ourselves, what do we really do as human rights defenders? What's our job about? I mean, why are we in this, and what is it to be a human rights activist in the first place? Where did we all come from? Where did I come from to be in this kind of work? This is, for many of us, not even a job. It's a vocation. Right? And we have a way of looking at ourselves as activists and as human rights defenders. And I think very commonly, we look at ourselves as people who defend and therefore needs to be adversarial. And I think if we look at the work we've been doing for many, many years, what do? We monitor for violations, abuse of human rights, we document and investigate, we expose, we report, we seek accountability, right? And those are the traditional jobs or roles we take. And many times it gives us an adversarial reputation. That actually the state is not always happy with us most of the time because we rock the boat. But in these COVID times, how are those roles going to continue? When we don't have media, maybe all we have access to is social media. But the moment you say something quite different or against the state, you be accused as a fake news propagandist. You're called out, you're trolled, you are trolled in social media. And before you know it, you feel vulnerable. But in my own career, I should not call it a career. As I said, this is a vocation for me. This is not my livelihood. I'm a psychiatrist. That's how I live and feed myself. But this vocation has luckily ushered me into a different context. Since I became more institutional in my role, being with the UN, and needing to learn diplomacy, needing to learn collaboration and confidentiality. Because as a member of the UN Subcommittee on Prevention of Torture, I'm not even allowed to speak about my own country, nor am I allowed to speak about other countries. Our job is like the International Red Cross. So how does one operate? Continuing to feel like a human rights defender under all these different frameworks and contexts. And luckily, it's helping me now, because I'm a member of our local or national preventive mechanism, which monitors our prisons and places of detention. And maybe because civil society organizations have had a long tradition here in the country of credibility, maybe trustworthiness, the effect that there will be some government organizations who will be willing to work with us, like the Commission on Human Rights. They have established this national preventive mechanism with a majority of us representing the civil society. How to engage this group now under COVID is my challenge. Because right now, all offices are locked down, closed, even the Commission on Human Rights is closed, but there is our chat group, there is social media. So I start calling on people, hey, what are we doing? There are these guidelines from the UN that all NPMs must continue monitoring. How in the hell do we continue monitoring when places are locked down, right? When newspapers are shut down. And then I realized, this is the change in paradigm or thinking that Visla is talking about, I think. That this is what I've learned from the UN in all these years, 8 years of working, diplomacy and collaboration. First, I had to convince our Bureau of Jail Management and Penology that we are not wearing the usual hat of monitoring and calling them out for human rights violations. First thing I did, I offered to give them personnel protective equipment. Our jail guards are handling COVID patients without any protective equipment, not even masks. And when I saw the count of COVID cases in prisons, it is scary. And if we do not do anything about it, we will never, ever be able to flatten our curve. Because we have such a huge population. We have 600 to 1,000% congestion in this country. So first thing I do, I offer the general, I will try to get you some PPEs. And good enough, my organization had enough for frontliners in the prisons. Now we are able to generate more cooperation, especially with regards to information, because how can we be human rights defenders when we do not even have access to information? There are reports of so many deaths happening unreported. Only this morning I got. But even families are unwilling to talk. So our civil society organizations are having a hard time documenting, getting the information to even expose what is going on. But we found as what should I call half civil society, half government institution as a national preventive mechanism, the avenue, the way to even just talk, to have a conversation. Look, we are not here to just monitor you. We are not just here to demand from you that you should do this, do that, but we are here to assist you. And I think that's the new call for us human rights defenders to learn how to move out of that adversarial position and find the balance. Not to completely leave it. The reportorial mechanism in the UN is very important. I mean, civil society has to continue reporting violations and have the mechanism for it. But we have to also have a collaborative mechanism. So balance between accountability and cooperation. Thank you.
I would like to actually call on Katrina, if you'd like to respond to any of the points here raised, and or elaborate on some of the things that you are talking about. But I also, after that, I would like to call on Corina, if you'd like to maybe help answer this idea about, how can organizations and funders manage this. And I think one important, interesting point that can be, that we can help to innovate or think about is how do we make funders become more aware of the mental health aspects of human rights defenders and social workers, right? How do we build that into funding mechanisms as well? So first, Katrina, if you'd like to respond.
Hi, sorry, I wasn't really expecting to say anything apart from my numerous comments in the chat. So thank you for that. And thank you so much for fielding those questions. I think part of it was just the feeling heard and validated that these are things that people are also thinking about and navigating. It's a good reminder, and I appreciate that. I think there are these broader ways in which we need to rethink how we do our activism, and I completely agree with that. And that's that process of imagination and thinking beyond what we already know and interrogating our current structures. I agree, but at the same time, also there's like stuff that needs to be done now, right? There is urgency and timeliness of people needing aid in certain ways, or people being locked up in detention and trying to like figure out how you get them out. Then there's just like people being arrested for all kinds of, there's just so many issues, right? That is not hypothetical in the future for how we rethink our work. Or also just as human rights activists, you can see sort of these issues unfolding, and there's a sense of, okay, holy shit, we need to do something about it. We need to talk about it. And then in our circles of work, there's a real sense of people feeling like, yeah, but who? And we're all so tired. And also the context in Malaysia and in many of the other countries also. Like COVID is another stressor that we're facing this year. We've gone through like political upheavals. We've gone through so many different changes, and it feels like just continuous shocks over and over again. And so sometimes people say like human rights defenders think they are heroes or superheroes. I really don't think I'm a superhero. I think that I try to be like really honest about how I'm feeling. But also I don't know how to navigate that, because I also feel like it feels terrible to not be responding when you think you can or should, or like also giving the pressure and the responsibility onto others who maybe aren't so willing to say that they can't manage it, but that they are also struggling. So if we're all in this together, like what does that mean for us to be looking out for each other together? It's just all over the place. So thank you. Yeah.
Thank you for that, Katrina. Karina, do you have any reflections?
Thank you. Thank you, Pang. Perhaps we can just share the experience itself of innovation for change. I think very early on, we had to convey to our donors and partners that even the staff of innovation for change were experiencing trauma, and on very different levels, like of fear, of you know, whether real or imagined illnesses, um, from lack of information, perhaps fear of their security in the face of the upcoming lockdowns. So I think we were quick to convey to them that we needed to provide for our team so that they could provide for themselves and their families. That first of all. So that was first adjustment, and for us to convey that we ourselves are going through trauma, and I think they were also quick to admit that they themselves are also going through this trauma. So there was that at least that um, unity in appreciating the how the pandemic is affecting all of us. Not just, we're not just looking at them as donors and us as partners, but we are all people experiencing this traumatic um, situation. So and I think that led us to be more forgiving, for example, of the time it needs to take us to be able to get back, if there's such a thing, because we are dealing with daily challenges as well. So we needed to rethink the programs that we are doing, and I think we were also being kind to ourselves in terms of um, timelines, um, in terms of not pushing ourselves so much just to appear productive and being worthy of donor support, but really that we are being true to ourselves as persons suffering trauma and as persons who are rights defenders and being part of different communities that are upholding rights of people and communities as well. And this also led us to adjust our programs and to really look at how we might be able to help people and communities respond and cope with the COVID pandemic. So I think these are among the things that we have had to do and communicate with the donors as well. And I think in our case, our donors have been very understanding and have given us the opportunity to calibrate things and not just in one go, but periodically as more information comes in, then we are able to adjust our programming as well.
Just
Okay.
adding on to Corina's point, I mean, absolutely. I mean, that conversation, I mean, again, this is me wearing my hat as director and in a position where I sometimes have to write funding applications, grant applications, and it's going back to that conversation with our donors and funders and, well, take on the role of educating them. I mean, some, as I think many of us in the room might know, some donors are slightly more enlightened than others. And yes, it can be exhausting, but at the same time, I think it's also incumbent upon us to do a bit of psychoeducation as well. So, for example, I think of an example where, um, say, your funder is coming from a very sexual health perspective. Well, just because the funding stream is sexual health related, it doesn't mean you can't talk about mental health. There's lots of research to show, lots of experience on the ground to show that sexual health or sexual wellness has an impact on mental wellness and the interconnections as well. So bringing back to the table and letting a funder, sponsor, donor know, hang on a minute, we're not just talking about sexual health in isolation, for example. We also need to talk about mental health, not just the mental health of the people we work with, but the mental health of our service providers as well. So that's just an example. Another example might be, say the corporate donor who may know not a single thing about the kind of mental health stress and that the staff and the volunteers feel. So have that conversation, a phone call, a Zoom call, and educate and give examples. I think perhaps the experience that many of us have is that donors and funders out there, they are hopefully enlightened and hopefully also willing to learn from us as well. So yeah, this is something to think about. I mean, it does involve a bit more work, and I can say it often is worthwhile. It means we get the money, right? So
I would actually like to open the conversation up to the other participants as well at this point. That, you know, it'd be also interesting to hear from others about the kind of conversations that you have tried to have either with your funders or your directors or your colleagues about mental health and how you can set up, uh, abilities for us to pay more attention to this or work around it. And I think paying also, especially with regards to, I think what Katrina has shared very powerfully in her latest contribution, uh, which is that, you know, our measurement of time has really shifted. Everything takes so much longer, but there's also a tension because I think we assume technology makes things quicker, more instantaneous. I appreciate all those points. Part of our imagination work is recalculation, re-understanding of time. And I think a lot of measurements of productivity and work is time-based, right? I mean, we use, in fact, the word time-bound is one of the ways we measure as part of the components of what we call SMART, right? Uh, and and I think with this reflection of how time has changed uh, is also important. So anyway, I'd like to open up for other participants if you want to jump in uh, to share about how the kind of conversations you've been having about mental health during this time with your colleagues or bosses or funders. Anyone? If you click on
Yeah,
the okay,
can
go ahead.
jump in. Right. Um, Regarding our situations as NGOs, people whose life is actually to generate proposals and get funding, I share that feeling, and maybe partly why I've never founded my own NGO until maybe forced to do it 3 years ago because of the um, Haiyan calamity, and there were so many willing to offer funds for that along mental health. So I was forced to put up an NGO that was all registered and accredited and so forth, just to be able to get some funds. But it is truly, even before COVID, I think that has been kind of challenge and lingering anxiety within civil society, especially those who are running NGOs. You never know when you will get the next funding or the next tranche, or you will be able to make the deadline for reports, or a funder will be able to send the money on time and all that. So I guess we're kind of used to that kind of stress, and how much flexibility our funders will be able to manage. And I think the real sincere and highly aware funders will be willing to be flexible enough. I belong to an organization, this is a foundation, which was, it took me quite a bit of arguing that one of our first funding campaign should be on money for personnel protection equipment. And I got a very simple reaction from my board. We are not a health NGO, right? But when the stark reality of how COVID was killing off frontliners, then everyone said, to hell with the Stock Exchange Commission, who might run after us, or the Bureau of Internal Regulation, who might be looking for receipts and all that. But, you know, I think we are adaptable, very, I would say, creative people in facing this kind of challenges. I think what is really a bigger problem is how, your next question actually, the third question, is how do we deal with vulnerable populations, communities. As human rights defenders, maybe this is one aspect that we need to look into, that human rights is not simply defending rights, liberties, but also the basic necessities and providing that for our communities. And that has kind of changed for us. This national preventive mechanism, I have asked our civil society members to take care, for example, of preparing for the early release of prisoners, because that is a global call for those in pre-trial detention and those faced with minimum charges to be released. For vulnerable populations like the elderly, women, to be released, the youth to be released. But question is, how do you release them, and to whom do you release them? Many of these people, especially the elderly, have no families to go home to. They will want to stay in jail or in prison because they have 3 meals a day. So there are things that are called for in global guidelines, but are not really very concrete, are not very practical, especially in the third world. So I've asked our civil society members to focus on this. How do you engage family support when there is no family visit allowed these days? How do you protect the rights of family members, the rights of detainees to be continually contacting members of their family? The ICRC is quite amazing in this, aside from putting up medical facilities for isolation in some of our city jails, provincial jails. They have provided tablets for use of detainees so that detainees can have contact, online contact. Phones are allowed now for prisoners, unlike before when it was very, very restricted. So I think there are ways, and collaboration again is, I think, very crucial. And for them to listen, we can write the 100 pages of guidelines for authorities to follow. But if they continue to see us as adversarial people who will always put them on the defensive, I think it will not work. And for the community to make them feel safe as well. Because I think establishing safety is the first step in recovery from trauma. If one does not feel safe, again, the traumatic symptoms, the stress will not abate, it will continue. So the sense of safety has to be returned. How do we do that? First, we make ourselves feel safe as well. We have to protect ourselves. I have put down my foot when I hear from Geneva that we have to continue physical visits to prisons. You will not get me to visit a prison these days, right? Without those space suits that doctors have to wear as frontliners, who will dare visit a prison or a detention center, right? But I can think of something innovative, like Zoom meetings with wardens, Zoom meetings with inmates, as long as they are kept private and they have security where they are having those online meetings with us. So these are the things that I think have to be really more creative on our part, that they are not reasons not to be able to do what we are actually used to doing.
One of the things I was thinking about, sparked by Katrina's question, and then also from June, what she said earlier. I feel like perhaps one of the ways, I'm speaking from observing the situation in Malaysia. I feel like one of the ways that civil society may have fallen short on in terms of working is building and strengthening community. And I don't mean community in terms of identity. I think we have a lot of that, but I'm talking about community in terms of geography, time, space, that kind of thing, in specific areas. I was talking to someone who lives in very cramped housing. We call them flats in Malaysia, very small apartments, high rise, and they have no space and they are in one of the near one of the red zones. So they're not in a red zone, but they're close enough to a red zone, and they are lower economic status, and so the police have a more prevalent presence in that community, and they're not allowed to step out of their homes without any real reason. Who decides what real is? Who decides what valid is? And so we were thinking about how she and I were thinking about how she could cope with it. And one of the ideas I came up with, because they have a common area, so I just asked the question: would you and some of your neighbors like to take turns to go downstairs and put those markers on the floor to indicate 1 meter, or draw circles, or whatever it is, so people can still practice physical distancing, take turns to go downstairs and utilize the common space and things like that? And her first response was, sure, but we all hate each other. Because, you know, in Malaysia, everybody's defined by their ethnic identity. Everybody's defined by the color of your skin. So your kinship, your membership to the community is defined by that. So in a place like hers, where you had more of a mixed racial composition, nobody talks to each other, you know? And so she was like, I don't have the energy to start that now. I can't think about that because I'm more focused on not climbing up the walls because I'm going crazy, you know? So that just made me think about how we have our responses to these things have always been so piecemeal. Oh, this person wants help, let's run and give this person help. That person needs subsidies, or let's book up some money and give that person subsidies. And then what Dr. June raised a question of like, okay, fine, we release these prisoners, and then what? Where do they go? Right? Communities are hostile to prisoners. Communities are hostile to people who've been in jail for whatever purpose, right? So what are we releasing them into, right? And so I feel like these are examples of how we can work differently, you know, about working with communities, strengthening communities, identifying those, what do you call that, the fissures, and working to rebuild that, to build trust in communities, to rethink people's sense of identity and belonging and things like that. And I think that is going to be very important moving forward. And this is also going to be a bit of a challenge for mental health practitioners, because I think many of us are focused on one-on-one kind of work. And that's not going to be feasible for the mental health outcome that is just waiting for us after lockdown lifts. We are not prepared for it, right? And that kind of piecemeal one-to-one approach is not going to work, because it's going to exhaust all the systems. There aren't enough mental health professionals out there. Some of it is expensive. And so working within communities, rebuilding what Dr. June said, that sense of safety in those communities is going to be the starting point of, dare I say, healing or just fixing things post-lockdown.
Thanks for that, Gisela. I think that it's quite powerful and it gives us a lot to think about. And I want to also raise a question by Gavin in chat. For a lot of marginalized communities who are now stuck in a hostile environment or unsafe home, how do we create or suggest hope to them when we can't really think of one? Especially for some of them, tolerating or waiting for this to be over is their only hope. And I think he's probably referring to women in abusive homes, or even LGBT people in homophobic or transphobic homes. Yeah, what do we do?
I will be honest, and I will say that I am truly stumped by this question. I have no answer, and I'm so sorry.
I'm not so sure I got the question. Could you repeat it?
I guess, so I'll paraphrase, yes. Gavin is saying that there are many people from vulnerable communities like LGBT people or even women who are living in abusive relationships, and LGBT people living with homophobic parents or transphobic parents or family members. This situation, of course, has become uh, worse for them since they're living in close proximity 24/7 with their abusers or potentially their abusers. So how do we attend to their needs for people in these situations? And I see Yangpa indicated he wants to respond to it. Yeah.
Yep. So I was just reading that, and I was just thinking of from the perspective of, say, a queer young person. That's mostly kind of my experience of working of work supporting queer youth or queer adults as well in unsafe, and the idea of hope and space and safety certainly is an interconnected one. I know very often for many of us we see hope as a, well, understandably, a very linear, kind of a forward-looking thing, and rightly so. Hope is that. At the same time, I think we also need to draw strength from the hope that we've had before in the past. So perhaps also, I know sometimes it's also very difficult to look back and think of positive, hopeful memories. And that in itself, again, that's in no way dismissing the importance of looking forward in terms of hope. At the same time, looking backwards and at times where there was hope in our lives in the past and drawing strength from that as well, and kind of connect that with the idea of space. I know many of us live in small flats in Singapore too, as well as in Malaysia and other parts of the world, small physical spaces, and maybe perhaps also possible to challenge ourselves to for us to maybe redefine what space means, even if physical space is limited. Are there ways where we can define our own emotional spaces, our own mental spaces as well? So it is challenging. It does involve a bit of redefining and relooking. So just as an example, I kind of caught myself doing this over the weekend as well. I was kind of looking at a photo of a particular memory of taken at a time in the past, and just looking at it, kind of, I was grieving the loss of not being able to go back. It was a holiday photo of going back to that place. So that forward kind of a hope was kind of diminished, but then I kind of flipped it around, looked back to, well, that time when I was there as captured by that moment in that photo. That was also very powerful and kind of like revisiting the very joyful, very positive emotions I had. And again, I deliberately kind of invited myself to relive some of the sensory experiences of being in that place, what it felt like, what it smelled like, what it sounded like being there. Granted, it was momentary. It wasn't going to change my reality or anybody's reality by going back there. If anything, it reminds us of our capacity of looking back at our own resilience of a time where we had hope when things were different, and perhaps that may give us some strength for the forward-looking kind of hope. I know it sounds a bit tenuous. If we're able to do that often enough within the spaces that can create for themselves, perhaps that might work, even if it's a very incremental kind of a move. It's not going to change overnight with just one time, but again, that makes that little bit of time a bit more bearable. And then back to, I think there was an issue of being in a physically violent and abusive setting. Again, certainly in Singapore, there's been a lot of reminders that, that is certainly something that you can still reach out to the authorities for protection, even with our circuit measures in place. Physical violence is something that has to be dealt with by the authorities. So again, in case people are still concerned about breaching circuit breaker measures, calling the police for protection, that is something that can and should be done. Again, I hope that there's similar kind of messages sent out there by different authorities in different jurisdictions as well. And certainly, we are hearing reports of women's helplines and sexual assault lines going up as well. And that certainly is a message the helpliners are giving to women and vulnerable adults, vulnerable children, as something that they can and should do, reach out for help. Even here in Singapore, there's also a campaign for neighbors. Now that we're spending more time at home, for neighbors to report on each other should there be concerns about violence in your neighbor's home, whether it's against children or adults. So that's certainly something. It's a very clear message I think needs to be non-negotiable, getting help and support.
Thanks, Yampa. Go ahead, Jun.
Yeah, just a very short addition to what has already been said. I think what COVID cannot stop us from doing is information giving. And it's so much more important now and also much more easy because of digital technology, and people are tuned in. Even the poorest people in my country have a cell phone that they can listen to. So the social connection that is brought to us by the internet certainly, to my thinking, has revolutionized the way we reach people. And in the Philippines, my God, I have 3-4 Zoom meetings and webinars almost every day. We are on the 5th of a series of mental health webinars with an artist group who has provided very good technical assistance. And I started speaking about COVID as a form of trauma. And then we talked about family and COVID, how COVID affects the family dynamics and relationships and caregiving. And we are on our 4th. The 3rd session was about a COVID survivor, how he survived being a patient. And tomorrow we're going to have a forum, a panel to discuss with the caregiver of that particular COVID survivor. And the last will be an interview regarding frontliner, how a frontliner feels and works in these conditions. I'm sure there will be so many topics, even domestic violence and COVID. There's a joke going around that criminality has gone down, but domestic violence has gone up. And people are reaching out, are wanting to hear more information. And to add to what was mentioned about helplines, our psychiatric association has already a hotline for people who might want to go on a private consultation. Another group of psychologists have also started the helpline, and so forth. We have the usual hotline for suicide. I think those should remain functioning and actually should be even more active nowadays. And as I said, information giving is so important in reaching out to these vulnerable populations.
Thanks, Jun. Bisla, do you put your hand up?
I did. I think compared to Singapore and the Philippines and Malaysia, I think a lot more people, or there's a lot less access to technology compared to Singapore and the Philippines. Not everybody here has access to a mobile phone, and even fewer people, or not everybody has access to internet. Forget like proper connection or high-speed internet. What I'm also seeing in terms of working with marginalized communities is an absolute lack or an absence of communicating about COVID, about the lockdown in a language that is accessible, right? Since the pandemic started, there's been a whole shift in vocabulary. For some people, the word pandemic is a new thing. lockdown, social distancing, all this vocabulary. And this is a virus that even scientists are struggling to understand. And when we see people, I speak of the Malaysian experience, the social media response to people who are violating the lockdown or who don't understand the severity of the pandemic or who don't want to get tested, who don't want to go to the hospital, our response is hostile. We quickly call them stupid. We quickly, question their intelligence and all those kinds of things. But the fact is, understanding what is going on is a privilege. And I don't know why we haven't yet engaged groups to go into communities. I'm thinking more about the indigenous communities who are actually, also very, very cut off. Why we are not going into those communities to communicate to them, educate them about what's going on, and to talk about what they should prepare for in a language and in a mode that is accessible to them, right? We did this with HIV/AIDS. We had drama, we had plays, we had musicals, we had community groups going to villages to explain these things. A few years ago, when there was H1N1, I remember there were easily accessible, digestible pictographs on how to wash hands, why it's important to not spit, in public, and all those kinds of things. I am not seeing that with this in this pandemic. So this is also something we need to think about, and in terms of helping, to also consider that this is another way of helping, actually communicating the dangers, actually communicating this quote-unquote new normal that we're living in and we are told to be comfortable with. That's not being communicated to people who are not in city centers and who are from the more marginalized communities.
Thanks, Rizla. I think we're approaching the end of our discussion, but before we end, I think it's also important for us to reflect on hope, but hope also that in a way that is inviting for new ways of hoping even. And so I want to also pay attention to what Katrina said earlier, that even reimagining, rethinking requires energy, right? And not all of us have access to that same level of energy to reimagine, to think, because it demands a lot of letting go, a lot of facing up to the risks and the uncertainty. And a lot of us been talking about uncertainty, and a lot of our current model of working, our current model of productivity, our current model of reporting to funders depend on certain predictability, right, of outcomes and things like that. And all these are changing. So in the face of all this, what does hope mean, to all of us? And I'd like to invite all our participants here to actually maybe even share in the chat what does hope mean now for you, for us, and also invite our speakers to share, what does hope mean now? What kind of hope do you hold on to? Yeah, and even if there's none.
Okay, so I start. Right. I think all of us look at the numbers, and we're all hanging on to the daily news and seeing whether we are who is flattening that COVID curve. For me, that is a long way off for the Philippines and probably for the whole of Southeast Asia. But the mere fact that the number of deaths among my colleagues, doctors, has very significantly gone down. And the fact that today it was announced by my organization that we have deployed our 100,000 personal protective equipment. In other words, we have been able to distribute that many in the last 5 weeks, reaching more than 300 hospitals. It is certainly not enough, but the mere fact that there are concrete contributions to the situation gives me hope. And the fact that people are responding. It was so threatening in the beginning when government was not making it easy for private sector to move and denying so many accusations that they were not doing enough. And truly, private sector just waiting for an organization or several organizations they can trust. And so far, we've not even worried about supplies. Used to be spending so much just to try and import from Singapore and China for these PPEs. Now, our garments factories have shifted to producing these special gowns for frontliners. Those are to me hope, and more than the money or the availability of these supplies, it's the spirit, the compassion that has been demonstrated by, there are still people who will be so amoral to try and take advantage. We still get very bad products we paid for, which did not pass our medical grade quality, but they're not the majority. So for me, this COVID has brought the best in people. In some people the worst, but in most people it still brought up the best. And I think that's where my hope lies in.
Thanks for that, June. That's lovely. Young Pa?
Hope. My hope is in the familiar. The things that I have been doing and I'm consciously still wanting to do. So something I think that I've been doing very, subconsciously as well as consciously, is I still continue to do some of the things that I've always been doing. For example, when I'm at work, I'm sitting there, I'm listening to a particular type of music. That gives me a sense of familiarity, comfort, and continuity. Just to reflect back on, I think both June and Vizla shared a bit about their living arrangements. Well, I'm single, I'm living with my parents, they're elderly, so I'm really spending a lot of time with them now. Not through choice, through circumstance, and that in a strange way is, well, weird and also familiar because they are my parents. So that familiarity, I'm trying to find comfort in. I'm having so many regular meals, it's just unusual for me because I don't usually have regular meals. Now I am at home all day with my parents. I have regular meals. So that sense of familiarity is, like I said, it's giving me that sense of hope that, okay, in this strange, changing, uncertain world outside my window that I can see, here things are kind of very routine. And that familiarity and routineness I'm kind of holding on to. So that's where I'm finding hope.
Vizla?
I think on a personal level, I found a lot of hope in people around me. I mean, like, we're very far away from each other, but for me, a very altering experience was reaching out to people and saying, I'm in a bad state, and people rallying around me and organizing online sessions and meetings and drinking parties and things like that. For me, that was, one of the sweetest things, and I still very, value that, and that's given me a lot of hope. But also, I've drawn a lot of hope from a lot of stories I've been reading and seeing online of how people are just jumping in and helping each other. This is going to be very controversial, but my favorite story is how some of these drug cartels in the favelas in Brazil, in Rio de Janeiro, were fed up with Bolsonaro. They decided that he couldn't be trusted, and they imposed lockdowns in their own communities in the 5 years. They utilized all their black market, little connections, and made sure there was food in the community. They made sure people had access to to masks, and people were going to the hospital and they were testing and things like that available. I love it. I mean, it's a story of survival, it's a story of community, it's a story of resistance. And I think in this day and age, with people like Bolsonaro, with people like Trump, that's so important, and that gave me a lot.
Thanks for that. No, I think it's really radical and also important that we find hope in unexpected places, that we free ourselves to be able to see that, right? And I also want to acknowledge some of the things that people have been writing in the chat. Isari says that her hope is for urgent design thinking. I want to say that that's one of the things that we do quite well here at Innovation for Change, if I may say so myself, that we like to bring people together to dream big and to rethink, redesign the way we connect, the way we work. And hearing this conversation, I think has highlighted some of the new ways that we probably need to think about working together, and some of the things that we need to pay attention with. And I'd like to invite people actually to, if you have ideas, suggestions about, how we can incorporate that into the way we have these conversations across the region, please get in touch with us. And Corina wrote, hope is to be more mindful, a slower world in terms of how we deal with persons, communities, environments, situations. Marisa, that we are kinder to ourselves, to our expectations, to others. Andrew says we will emerge from this. Malik says his hope is being in the present and to be gentler and kinder. Philip says his hope comes from belief that people will exercise the flexibility and mindfulness they possess. Katrina, that the pandemic reveals, it tells us things about ourselves and the world. I've been getting hope from people seeing these revelations and reflecting and sharing with each other. I've never thought about my work as an activist will achieve all these goals in my lifetime, but all these steps matter. So seeing more and more people think about these things and be mindful together, that gives me hope. Shamini said, hope for me is a driving force to keep me going in these current uncertain times. I've drawn hope from different virtual experiences and sharing I have had working from home. And Judy said, I hope that she just hopes that humanity will prevail. And before I close, I'd like to invite Corina, if you have any reflections for us. As Corina closes, I also like to invite everyone to share the one takeaway you have from this chat. If you like, one thing that you have taken away or will take away from this conversation. But for now, Corina, if you'd like to share.
Okay, well, perhaps for me, what is very assuring from this conversation is that it's okay to be slow. It's okay to take your time and just be kind to ourselves. And I think, well, I currently live with a mother who was COVID positive, and another one, a caregiver who is also still experiencing some of the symptoms. So, like Yang Fa, I'm new to this household. I just moved in at the end of February, and I was just dealing with caring for my mother and being part of a large household of helpers and family members, and the transition has been immense for me, and that my mother also became a COVID patient was also very challenging. But I think I find comfort in music as well, and it really is. We really have to be in touch with ourselves to find how we might survive in such challenging situations, and seek solace in support from everyone. Of course, there's also you have to deal with neighbors who are fearful for themselves, for being very near a household that is COVID positive. There's a lot that we have to deal with, and really kindness is needed at this time.
Thank you, Corina. I guess we've come to the end of this very hopeful and lovely conversation. If you want to get in touch with us, please like us or follow us on our Facebook, Innovation for Change East Asia. We will probably announce our next conversation. I think our next conversation will be in 2 weeks' time, and it will be about cover-ups and gags and disinformation in the age of COVID-19, and how we can overcome state attempts to punish people for whistleblowing as well. And it's because I think, as we reflected in this conversation today, information is very vital to us now. As we lose a sense of control, at least knowing what's going on is very vital. But yet, some of our states are actively curbing that. And so that will be an important conversation for us to have, and that's our next one. Please look out for it. You can also get in touch with any of us personally, and I don't know if Visla, June, and Yangpa are open to people connecting with them privately. If they are, I invite you to maybe leave your email address in the chat, and people can get in touch with you. Or not, I mean, no pressure. So for now, I guess I like to, okay, so the email addresses are being written there. Visla, Kumosa, Gmail. Okay. So all of them have put their email there, and Yangpa has provided a link to Uga Chaga's website. Thank you all, I think, for bearing your soul as well, for being so open and vulnerable and trusting this space. Thank you to Yangpa, Visla, and June for very open sharing. To Corina for leading us, and to Marisa for paying attention to the chat, and to Philip in the background, letting people in, and everyone who's taken part, and also for the work that you do in your community. So important, so powerful, which is why I think it's also important that we pay attention to ourselves and our space and our mind. So thank you to everyone. Till we meet again, stay well, stay safe, be kind to yourself.